Hello friends, let us see the upwelling bone, the clavicle. It is a bone which attaches with the manubrium in the midline exoskeleton and with the acromion process of the scapula on the lateral side. This bone is considered as a modified long bone. So question arises is why it is a modified long bone. So this is the only bone which lies horizontally in our body and it is subcutaneous throughout. So this is the only long bone which lies horizontally in our body and it is subcutaneous throughout. That is why it is considered as a modified long bone. It having some other peculiarities also, like it do not have any medullary cavity. It is the first bone to ossify around 5 to 6 weeks in intrauterine life. It has two primary center of the ossification. It ossifies in the membrane. It lying horizontally in our body. It is subcutaneous throughout, which means we can palpate it throughout, and sometimes it is pierced by middle supraclavicular nerve. So it having around 7 peculiarities, and it is most commonly asked viva question during your medical examination. So clavicle. Now let us see its feature. First let us determine its side. So this is the clavicle bone and you can see it having a two ends as it lies horizontally. So it having a medial and lateral end. So let us first determine the ends of the clavicle. So it having a two ends. One end is quadrilateral in shape. It is around somehow rounded and quadrilateral. You can see here. And another end is the flat. It is flat from anterior to posterior side. You can see it is a flat bone, flat end. So the end which is quadrilateral and little bit rounded, it is the medial end of the clavicle, and the end which is flat, it will be the lateral end of the clavicle. Now look at the shaft. You can see this shaft having a S-shaped curvature in which it having a concave and convex part on the anterior side. So this bone which having a medial 2/3 portion which is convex anteriorly, and it having a lateral 1/3 portion which is concave anteriorly. Okay, so this should be on the medial side. This is the medial end, quadrilateral, and the convexity should be on the medial side towards the midline, right? On the medial side, medial 2/3, convex anteriorly, lateral 1/3, concave anteriorly. And the shaft in its lower part, in its inferior surface, it having a one groove. You can see here in the inferior surface it having a groove which is known as the subclavian groove. This groove should lies on the inferior side. So how you can determine the side? First see its ends. The medial end should be quadrilateral rounded, the lateral end should be flat from anterior to posterior side. Okay, so this should be, you should keep this on the medial side towards the midline. Okay, and this should be on the lateral side. And the convexity of the shaft should be medial 2/3 should be anteriorly, lateral 1/3 should be concave anteriorly. This should be convex anteriorly, this should be concave anteriorly. And the inferior surface of the shaft, it should have a groove which is known as the subclavian groove. So this bone which I am holding right now, it is a bone of the left side. So I should hold it in a left hand. Okay, now let us see the features quickly. So it having a two end, medial and quadrilateral, lateral and flat. The lateral end having a two borders. This one is the anterior border, concave anteriorly. This one is the posterior border, convex posteriorly. It having a two surface. This is the superior surface and this one is the inferior surface. Now inferior surface of the lateral end, it having a two structures. One is the tubercle, another one is the ridge. This tubercle is known as the, this one is the conoid tubercle, and this is known as the trapezoid ridge. This is the trapezoid ridge, this one is the conoid tubercle. So lateral hand having two borders, anterior concave anteriorly, posterior border convex. Two surfaces, superior surface, and this is the inferior surface. Superior surface smooth, inferior surface having a conoid tubercle and trapezoid ridge. One more thing you can see at the inferior surface towards this posterior inferior surface is the articular surface. Okay, one more thing you can see at the lateral end is the articular surface, the over-articular surface which articulates with the acromion process. So here there is a articular surface for the acromion process. So this is about features of the lateral end. Now let us see about the medial end and the shaft. Medial end is quadrilateral, and the medial two-thirds of the shaft is convex anteriorly on the anterior side. It having four surfaces. This is the superior surface which is smooth. This one is the anterior surface which is convex. This is the posterior surface, again it is a smooth, and this one is the inferior surface. Inferior surface having two features. One is the subclavian groove which runs along the middle of the shaft of the clavicle, and on the medial end of the clavicle we can see the articular surface. Here we can see this is the articular surface which articulate with the costal cartilage of the first rib. Okay, so medial end having a superior surface, anterior surface, posterior surface, and inferior surface. Inferior surface having a subclavian groove and articular facet for the attachment of the first costal cartilage. Now let us see the attachments. On the lateral end, anterior border, it gives origin here. It gives origin to the deltoid muscles, anterior fiber of the deltoid. The posterior surface, it receives the insertion of the trapezius. Here will be the deltoid, here will be the insertion of the trapezius. And inferior surface, here around the articular surface there is a capsular ligament of the acromioclavicular joint, and on the conoid and trapezoid ridge here there is the conoid and trapezoid part of the coricoclavicular ligament. This is the important point here. Coricoclavicular ligament helps in transmission of the weight of upper limb towards the axial skeleton. So coricoclavicular ligament having a two part, conoid and trapezoid part. Conoid and the trapezoid part of the coricoclavicular ligament attaches on the conoid and trapezoid ridge. So this is the conoid tubercle, this is the trapezoid ridge. Now let us move toward the medial side attachment. On the medial side, superior surface, here it gives origin to the sternocleidomastoid muscle. Here there will be the origin of the sternocleidomastoid. On the anterior surface, here on the anterior surface, medial two-third portion, it gives origin to the pectoralis major muscle. Here there will be the origin of the pectoralis major muscle. On the posterior side, here there is the origin of the on the posterior surface, here on the medial side there is the origin of the sternohyoid muscle here, and on the inferior surface on the subclavian groove here on the subclavian groove the subclavius muscle arises, and around the articular surface on the inferior surface there is the attachment of the costoclavicular ligament here, costoclavicular ligament, and on the medial end, this one here On the margins of the medial end, there is the attachment of the capsular ligament of sternoclavicular joint. Here, there is a capsular ligament of the sternoclavicular joint over here. So, this is about the clavicle. The most frequently asked or commonly asked question during the viva is one is its peculiarities. You should remember its peculiarities, and another important questions are, one is the corticoclavicular ligament. You should remember it should help in the weight transmission. And another thing you should remember that this ligament having a two parts, conoid and trapezoid part. This thing you should remember. Another, they can be asked that this joint between the sternum and the clavicle, sternoclavicular joint, it is which type of the joint? It will make the saddle variety of the synovial joint. This will be the plain variety of the synovial joint. And the clinical related to the clavicle is the absence of the clavicle, which is known as the cleidocranial dystosis. Cleidocraniodystosis. So this is the clinical condition where the partial or complete absence of the clavicle is there, and the person which having this deformity, they can touch their shoulders anteriorly. So, and in the chest x-ray, the clavicle is completely not visible. So the applied anatomy related to the clavicle is cleidocranial dystosis. Okay, so thank you very much. If you like my videos, please subscribe this channel. Learn anatomy with Different, and you can suggest and give your comments about what next videos you want. Thank you so much.